Research and innovation in Futuris.
The tumour on my liver was in a place which was difficult to access.
I have really tiny blood vessels, so surgeons were afraid that surgery would maybe not be successful. They told me that I had many cysts, but there was nothing they could do, so I just waited.
My disease started in 2004. The first symptom was very serious hypertension.
The personal dramas when dealing with serious diseases, and a powerful tool to fight them, virtual physiology. This is the story of the secrets of a new generation of sophisticated medical computer models and the hope they offer. At this hospital in Brussels, surgery is a daily routine. But this is unlike any other. Surgeons are surgically removing a tumour in a liver. A 3D computer model is guiding them to look at the tumour itself, this green spot, surrounded by blood vessels.
The images let us anticipate the way the blood arrives and leaves the tumour. So the objective is to plan exactly the area of the liver from which the cancer will be removed, while preserving a maximum of healthy tissue. It's much more precise. It's like a GPS system on a car which takes you to the exact location, having first recognized the coordinates.
This and other models are the outcome of a European Union research project aimed at developing virtual tools to improve the surgical approach to different liver diseases. The technology has even been upgraded here in Strasbourg. This audiovisual control room belongs to a hospital research centre. Live pictures from surgery are merged with 3D computer models of the patient's liver. The mixed picture is sent back in real time to surgery so that surgeons can use it straight away.
The surgeon knows exactly where to go, whereas normally human bodies are not transparent. He sees behind the surface of the organs or the position of the blood vessels or tumours, so it's safer.
These 3D computer models not only offer better surgical training and practice, they also help to determine eligibility for surgery, and that, researchers say, is already saving lives.
In the past, anatomy textbooks said there are 8 main areas in the liver. When there was a tumour in one part of them, it was assumed that the whole region had to be removed completely. Surgeons say that if we did that, the patient would die of liver failure. But in reality, we found each patient has a variable number of areas. We can personalise this software to each person's anatomy. Now we can operate on patients on whom we couldn't before.
That was the case for these 2 patients in Brussels. Emile had cancer in one area of the liver. Teresa has a genetic disease that causes her liver to be covered with cysts. 3D personalised models help to perform surgery, while they are used routinely in both patients' medical checkups.
Doctors were able to confirm with these 3D models that cysts covered most of my liver. They said that if I hadn't had surgery, I would have had to have a liver transplant.
You can see the vascularization of this healthy liver. Here the liver is functioning. Also, we can see clearly how this part has practically doubled in size since we removed the cysts which compress the blood vessels.
And before, you couldn't see all this?
Before, it was certainly very difficult to see all this by keyhole surgery. We always had to explore a little. But here the surgeon has a vision of the vascular system of the liver that is much more accurate since it's three-dimensional.
further south, a different problem in an equally sensitive human organ. Francesca and Paolo met at the nephrology unit of a hospital in Bergamo. They suffer from serious renal disease and both need hemodialysis to clean their blood from waste.
I started coming to the hospital 3 days a week, 4 hours of hemodialysis every day. 3 months ago I changed. Now I come here 3 nights every week, 8 hours of dialysis every night.
Surgery in the arm is necessary to guarantee the vascular access to hemodialysis. And the operation is sometimes far from simple.
My brother and I have small veins that are difficult to isolate and connect to the fistula that is linked with the dialysis equipment. It is called vascular access. I was lucky I had good access after surgery just once, but my brother needed it 3 times to have correct vascular access.
For hemodialysis to be effective, the patient's blood flow has to reach a minimum threshold. Preparation for surgery is done routinely with the help of ultrasound and clinical exams. But this does not always guarantee its success.
A vascular access that is not able to provide at least 300 milliliters of blood per second is inefficient. It just does not work for hemodialysis. If this blood flow cannot be reached, we need to intervene again, either from a clinical, surgical or pharmacological point of view. We need to ensure patients have an efficient vascular access.
Computer scientists have rushed to meet the needs of these patients and doctors. Researchers have developed computer models able to predict each patient's blood flow before they undergo surgery. The system can even predict what part of the patient's arm will provide more blood flow and how that blood flow will evolve over time, weeks or months after the surgery.
We have so far succeeded in predicting the blood flow quite accurately. There is scarcely a 15% difference in the rate between our predicted blood flow and the real blood flow after surgery. But this accuracy can still be improved. For that, we'll have to increase the number of clinical measurements performed on the patients.
We'll be indeed able to improve the calculation in 2 different ways. Concerning the system itself, ultrasounds now measure blood speed at just 1 point of the vascular system. But in the future, we'll be able to measure that flow at different points and different speeds. On the other hand, we'll be able to provide more accurate data by improving the existing mathematical models.
Researchers say this is just the first step in providing vascular surgeons with accurate data, extremely valuable in preparing sensitive human organs for surgery.
This technology will allow us to improve surgical practice when dealing with vascular systems in the heart, in the brain, or in other parts of the body. Surgeons will be able to predict in advance what to do in the case where a blood vessel is suddenly altered. They will be able to know before surgery if they need to use a bypass, or if they need to reconstruct a blood vessel or use a prosthesis.
Potrebbe decidere di usare un bypass, potrebbe decidere di usare una ricostruzione di un vaso o mettere una protesi.